Dear friends, I'm Raj Khilan, your host for Health Awareness Campaign, which we have started here with Sabrang TV. And today we will talk about autism. As we all know, autism is an increasingly common problem. It impacts not only the child, it also affects the surroundings of the child, the family, social connections of the family. It can have a negative impact on the marriage, on the school, and on the society what we live. But that can be reduced tremendously if we have the correct knowledge and if the intervention and therapies are started early. To get this knowledge more in detail, we have with us Dr. Malini. Dr. Malini, welcome to this show.
Thank you for having me.
Dr. Malini has a wealth of experience in psychology of nearly 20 years. Correct me if I'm wrong.
I think yes.
And around 15 years of experience working with children and adults with disability. And of course, she's qualified as a PhD. So good research. Welcome to this show.
Thank you.
I would like to first ask you that generally in practice we see parents say and ask about this question is that autism is getting common and common, and some of the patients say or parents say that we never heard of this term before. Is it the truth? Because you see a lot of patients and diagnosed children with autism. Is that the truth or is that a myth?
It's a very commonly asked question, so I think it's a really good starting question. Over the years, the incidence of autism is very visible on the media. We hear a lot about it, and our way of diagnosing these difficulties, the social difficulties, emotional difficulties of children, adolescents, and adults, is definitely improving. We have much easier and much more earlier ways to detect these things. So what was commonly seen as being different is now being looked at, and we can see that it's part of being on the ASD spectrum. So early diagnosis is probably more responsible for us seeing this more commonly and being more aware of it.
Good. So, is that increasingly is getting common in more of a South Asian family or children, and particularly in context with an Indian background? I would like to ask, and because most of the patients we see in our practice, they asked we never heard this diagnosis back in our country, and why it is common over here.
Absolutely. I think this awareness of ASD is increasing globally, and our community is no exception. So we are going to find that increasingly diagnosis and treatment options are going to become more available for families in India, and we can't be spared. So our knowledge will definitely extend to understanding differences which we are more culturally accepting of. We accept people who may be a bit different, and now we can see that they are struggling with autism or higher functioning ASD, and that there are lots of ways in which we can help these families, children, adults, to make their social world a lot easier for them.
So in this way, it means for the take-home message for our families is that we Indian are not immune to this diagnosis, but probably we, as a medical professional, health professional, are become more knowledgeable, and the health facilities in Australia are more. So probably we are diagnosing these patients, these children early, so that we can provide them appropriate help and intervention.
Absolutely. Unfortunately, as a community, we're most definitely not immune, and being a very large population, even a smaller percentage would represent a much larger number per se.
Very well. Another thing I would like to ask you, Dr. Malani, about we talked about early detection and early, everything comes in early. But as a young parent, how would they know that their child is having this problem? How, as a layman, should try to look for these things? And what are the early pointers they should look for so that they can seek help?
Thank you for asking such an important question, and I'm really, really passionate about early intervention, and I'm really passionate about helping children as soon as we can. And one of the things is children are presenting for services around the age of maybe 3 or 4, mostly when parents are very concerned that the child isn't talking or their language is delayed. However, from a very infant point of view, a very early point of view, I think there are lots of warning signs that we can look for, and it would be really helpful for us to create an awareness of that. So in babies and in infants, I think it's really important to look out for babies who might not be responding quite so readily as other babies. So that would include just being aware. If your baby isn't smiling at you when you smile at them, or they're not really waving or engaging with social greetings, if they're not tracking visually,
Yeah.
and sometimes some children are a lot more sensitive to noise, or they might be fussy eaters. It wouldn't hurt if we just had a little look to see if there was something developmentally that was challenging those babies, and if there's something we can do to help.
Yeah, and I think, Dr. Malani, this is a very nice and early thing to look at how we can diagnose these children early and or pick up early. As you rightly said, very fussy eating habit or issues of textures, or not tracking, not understanding, and not having a good eye contact in early
Definitely.
stage. And these are the important signs. Or child who's not sleeping well and having some sort of a sleeping difficulty, and not using the body language, body gestures, explaining himself or herself, and not bringing a lot of facial expression. These are the important early pointer signs where the parents should seek help for early diagnosis, and so that they can be helped early. We were talking about the language development point of view, and particularly we see but me and you both are from the back Indian background, and we do see children from multicultural society with a different languages spoken at home, and some of the family they speak maybe 2 or 3 languages. Wife is from different language, husband is speaking different language, and child is of course born here, so likely to speak English. And generally parents say, my child is not speaking or not talking because he's getting confused with the multiple languages.
Yes.
And what do you think? Is there any thought about it? And is there any really research or and anything pointing that the different languages can impact a child's language development?
Well, there are lots of mixed views on that, and there's a lot of research showing that children who speak or rather come from bilingual backgrounds don't particularly have an increased capacity for language development, but they actually tend to be more creative and lateral thinkers. So it actually helps our abstract thinking, and children from bilingual families are picking up other languages quite naturally in their home environment. So it's a very natural process for them. Language development has a critical age per se. So before the age of 7, children are just developing an understanding unlike an adult who learns language in a very conscious way. So my personal thought is that it actually is to be encouraged, and I don't feel per se that it could detract from a child's development.
Okay. It's very interesting to know, I think, for all families that generally we feel that the different many language spoken at home can confuse the child to develop the language development or the speech and maybe a contributing factor for the speech delay. But as Dr. Malini said, and the majority of the research shows that multiple languages spoken does not impact the child's speech development. So, in case your child is not speaking any language, any words, whatever language you speak at home by 18 months, or not joining the two words together, I think you should seek a help for further assessment. And it may not be autism, but it may be a simple speech delay. But looking for a further evaluation and assessment might be useful here to look into the total developmental assessment of the child. So, dear friends, we will have short break and we'll be back soon. Thank you. Welcome back, everyone. We are on health awareness campaign, and today we are talking on autism, and with us is Dr. Madhuri. So, just further on our talk on autism, Dr. Malini, I just wanted to know, in our practice, autism is, generally thought about it is generally associated with certain other problems. Diagnosis is one part. What are the other associated problems which, in practice, you are dealing with these children, and they are the common things?
Children who are struggling with their social and emotional development can find their world becoming increasingly anxious. Teenagers, especially, can be more prone to being depressed as they realize that they're feeling quite different and maybe not fitting in quite so much. We also see higher incidences of epilepsy. Sleeping problems are very prominent. Children often find it very hard to settle, and Dr. Raj, you might also like to share your thoughts on that.
Yes, there are, in my practice, we see, they struggle various way, and where they need help in various aspects, like languages, of course, is the one important thing. And then feeding difficulty.
That's
They are
right.
really very,
Yes.
very fussy in eating, some texture issues, and having vomiting with the different textures. Food could be another thing. Of course, their sleep is quite erratic, and sometimes they can be settled by sleep therapy, or they may need medications. And another problem could be behavioral issues in terms of the aggression, like head banging or hitting other children because they can't understand other person's perspective or emotions, or they have quite heightened impulsive emotions, maybe having associated ADHD, or maybe along with that might be associated with intellectual disability,
Yes.
and later on in a life, and might not be that smart to go to a normal streamlined school, and might need help of a specialized school. Where your area is quite, you're expert in children with disability, or adult with a disability. You got extensive work done. So what do you think in that area?
Well, when children present quite early, we have a very good chance of working with their language development, helping their understanding of how they interact with others, and also build their communication skills. So, you mentioned head banging. A lot of difficult behaviors are linked with poor communication skills. When children can't express themselves, they become far more physical about it. So, early intervention can help every child to reach their potential, and around the age of 5 to 6, we can then start to see if children have difficulties in their educational aptitude or ability. So are they at level with other children, or would they require specialist support? So specialist support would include schools that might offer support for children who require modified program,
Yeah.
and sometimes we also can refer to schools who specifically cater for children with autism,
Absolutely.
and quite a few of them are modeled along the lines of transition schools. So their aim would be to help children as much as they can to possibly be mainstreamed back. However, if children have intellectual delays and difficulties, often we do have to look at schooling that is geared for their needs.
Yeah. Another thing I just would like to know, particularly when it comes with this diagnosis, is the feeling of guilt and the feeling of blame for the parents and certain parents, because particularly if we talk in context with South Asian community, all the migrant population have come over here working hard to settle them. Parents are busy, they could not spend that much time with their children, and having one-to-one sort of a play, and child is left with the digital media, watching iPad, TV, laptop, for watching cartoon for 7 hours, 8 hours, because as long as the child is in front of TV watching something on on an iPad, he's behaving well. So they think this is working for my child. If I take the iPad off, this is going to be a blast over here. Child is not going to eat, not going to behave. And once the diagnosis come, then some parents, they start feeling in that way, oh, it means I did not spend that much time with the family, with the child, and that's one of the reason the child has developed autism. So that feeling of guilt and blame, it comes on that. I would like to know from psychologist perspective, what's your view in that way? How much that digital media, uh, of course I know it's a blessing, but how much that contribute to the diagnosis of autism? How much is the parental rearing can be as a contribution to the autism, or it's just a parental feeling which we need to help as a professional, that so that they don't go into that feeling of self-blame?
So I'll try to answer that as best as I can, Dr. Raj, and it's a question that I suppose I battle every day when parents chat to me on an emotional level about their parenting. So perhaps as a professional and also as a mom, I'd like to say that parenting comes with a certain amount of insight and sense of sometimes wanting to do so much for your children that you often question yourself and can feel quite guilty about not working too much, being at home too much, not being at home too much. So parenting, by virtue of our wanting to do the best for our children, can be a really difficult job emotionally. When you have a child with special needs and they are just different to other children, it often makes you feel quite inadequate. Parents often feel whatever they're doing isn't perhaps good enough, or they might have other children who respond quite well to crowds, or have more friends, get invited for birthday parties, and they have this one child who's been on the sidelines, who finds social things difficult, and who's just generally struggled. So there is often that sense of what they could have done differently to make things easier for their child. So I would like to say to all the parents out there that children with ASD have a very different way of seeing the world. Their brains are wired quite differently. We would consider it to be a developmental difficulty that does not, that isn't because of poor or bad parenting skills, but there's a lot we can do to help to make our children's lives easier when they struggle with ASD. And that brings me to that issue of how do we use technology, perhaps. technology is so widely available, and I think that there are some very wonderful ways, like you said, in which we can use technology, but it definitely requires a lot of monitoring and how we use technology with children with ASD, because they love technology like any other child. So, like you said, if you overuse technology, it can be a socially isolating factor. But we can use very interactive programs to help build children's emotional development. In fact, technology is used very widely for children on the spectrum. However, I think we do need to have professionals perhaps involved in helping us to see the number of hours we watch TV, or how we use technology as an incentive or reward, and definitely with the aim of helping to build social and emotional skills.
Yeah, very good answer. So, in a short way, maybe we can say, or we can accept that for the family point of view, that parenting is not causing much contribution in terms of, not contribution, in fact, the bad parenting or parenting does not cause autism. Can we take it that way? But yes, a good parenting is important for a child who has been diagnosed with autism, so that we can help that child. It is important to have more structured play with the child, interactive play with the child, more time spent with the child. That would be useful, helping child learning emotions, reading emotions, developing language, and also helping behavior and developing age appropriate play skill. Technology is important, but overuse of a technology, again, it does not cause autism, but yes, it adds to the behavioral problems. Generally, we don't suggest too much of a screen watching. Screen could be of any type, could be a iPad, laptop, TV, watching on phone. It should be very limited. In general rule, without any, I'm not quoting any scientific data here. In general rule, accepted rule, children less than 2 years should not watch TV or any screen. 2 to 5 years, generally around 1 hour of TV watch is okay, and more than 5 years, generally more than 2 hours of watching any TV or screen. But important thing also is to look into what are the content, what they are watching. It should not be scary, monster type of things. It should not be having a violence associated with that. That can also lead impact, and children with autism can take these things very literally because they can't read in between the line. Coming back to you, Dr. Malini, other thing which we see particularly in a South Asian community, when the diagnosis is made and they sometimes ask, because of the back pressure from the family back home in India, or grandparents' pressure, or this diagnosis does not exist back here, so why don't you send your child back to India or back to their homeland, because you are alone, you are struggling, you are trying to work hard, your child is left alone here, and that's why your child is behaving abnormally. Second part of the thing, at the same time, I would like to know about social stigma which we feel, perceive ourselves, that not to tell this diagnosis, which may be culturally or traditionally based, but not to reveal the diagnosis to family and friends, and keeping the diagnosis within, and struggling as a person, as a family with the child, and keep struggling. This can end up to some sort of a very bad outcome. What do you say about that two important issues? Should they send their child back to India? Is that the truth? And second thing, if they have to reveal the diagnosis, what should be the more sensitive way to talk to the grandparents about the diagnosis, talk to the society about the diagnosis, how acceptable our society is in Australia for this diagnosis?
I think these are really important and useful questions, Dr. Raj. So, thank you for the opportunity. Firstly, I'd like to say that it can be very confusing for families to be faced with autism. It can be very confusing for um, an older generation of grandparents who have never heard of anything to actually hear something that they don't understand. So, the natural reflex is to point towards wanting a simpler solution. So, if your child isn't talking, if they aren't integrating socially, then it's possible that maybe coming back to India or being in a more familiar surrounding or hearing more of their own cultural subtext might help the child's development. And while there is nothing wrong with that per se, my sense is that being a neurodevelopmental condition, the children show the same difficulties that they would have at certain ages, irrespective of the where they are. So, for example, children can often show some very normal development of language, but they can just stop. And you may have heard many times parents coming and saying, he was talking, he was saying mom, dad, and then he just stopped. And depending on when that happens, parents can often perceive that as part of a big transition, and it may well be. However, I think just being able to have more family around, although its advantages from a social point of view or an emotional point of view, doesn't quite address or is not a substitute for early intervention services. Children on the spectrum need specialist services to help build their communication. We have these options available. We probably didn't 20 years ago to this extent, and it would be, in my view, I consider it a lot of time lost if we don't help those children with specific interventions and try to resolve their communication difficulties just from a psychosocial perspective. So that's one sort of view that I do want to point out. And secondly, in terms of the stigma, um, it can be very difficult to accept a diagnosis that doesn't seem to have any physical markers. So you can see a child, for example, who has Down syndrome. They may look a little bit different, but children with ASD look like any other child. So that makes it a little bit different, I think, sometimes for parents to understand uh, something that is so hard to sometimes see. But the more we try to hide something, I think it can be quite disastrous for the child per se, because children also feel different and they feel they don't fit in, especially for children who are higher functioning. So for them to understand themselves, for us to be able to help not just a child but an entire family, and for everybody to do their best to fit in, I think it's fairly important that we try to be open and transparent. And by denying a problem, we can often deny children and adolescents and adults the help that they need and that we are in a position to offer, more so now than we did before.
Absolutely right, and very well you said, Dr. Malini. I think cultural based issues are always there with this diagnosis attached. Sending back home is not the options. It means we are keeping this child away from all the help which is available in Australia for them. Our society here is more open and more have more acceptance for this diagnosis and children with this problem. Various type of help is available which should be offered, and that's why I'm going to ask the last questions. what help available for these children?
Depending on how early we see children interacting a little bit differently with their environment, uh, I feel it's really important to keep in touch with your pediatrician from a young age, where, and also to have regular screenings with your maternal health nurse services. I also think kindergarten schools are very important because that's the stage where children start to meet other children and develop some um, very important social bonding. And so, if at various stages, under the age of 1 up to the age of 2, you start to see language. At 3, you start to see social interactions and interactive play. And at 4 years, you can see quite easily how children are developing in terms of their social needs, in terms of language, and in terms of their emotional interactions with others. So, from an early interaction point of view, before children go to school, there's lots of support and help available. In fact, our focus is on early intervention, and at the moment, we have funding being rolled out through various agencies that can be helped.
Like NDIS, Early Intervention Childhood
Exactly.
Services. Yeah.
And the Helping Children with Autism initiative, which will specifically look at helping children with occupational therapy, psychological therapy, speech therapy, and a whole host of different services available for more intensive support, for especially for non-verbal children. When we move out of the early intervention model, uh, the support for children is more around skill building, and the role of schools, teachers, and support services is really important for children from the age of 7 to 12, and then teenage services that also focus on their mental health and the coincidence of these difficulties perhaps being higher for children who find social emotional difficulties much harder in their adolescence than other children. So there is a lot of help available and lots of professionals that we can talk to. Early detection and involving professionals is probably one of the most important things we can do.
Absolutely. Absolutely. So with these last questions, we are going to finish this program, going to end this program, and hope all of you like this program and you, I'm sure, would be benefited. But at the same time, I would like your feedback. Please write all of you to us so that we can improve our program in future. And also, don't hesitate to write if any other medical issues you want to discuss in future, and we would love to bring that medical issue, particularly in context with our community. Aim of this program is to create awareness about the health related issues in our community, particularly in South Asian community. Thank you. Thank you, Dr. Malini.
Thank you, Dr. Raj.